Good to have you with us on the weekend edition of the Urban Debate. The big talking point in the country today is the approval that has come in for the next vaccine, the Zydus Cadila vaccine, Zycov-D. And why is this one grabbing everybody's attention? Firstly, and most importantly, because it has gotten the approval for those above the age of 12. So not just adults above the age of 18. But Zycov-D can also be administered to children above the age of 12. Now, what do we know so far about this vaccine that's gotten the emergency use approval from the regulator? They're going to start the production and the doses are likely to hit the markets in another month or so. They're hoping to then ramp up their production and maybe give us 3 to 4 crore vaccines by the end of the year. This is not a needle administered vaccine. It's going to be needle-less. For many, it will be painless in that sense. How exactly will the administration happen? We need to wait and watch. The company says it will be like a jet spray. And also, interestingly, it's a 3-dose vaccine. Currently, we have Covaxin and Covishield in our country and Sputnik. These are 2-dose vaccines. There is Johnson & Johnson available globally, which is a single-dose shot as well. And they are now applying to get permission to come to India. But Zycov-D is a 3-dose vaccine. So tonight we have the experts telling us all you need to know about vaccinating children. This first vaccine, which will be available for children in our country above the age of 12, and what others are we watching out for? There are many more in the pipeline as well. Let's say good evening to Dr. Chandrakant Lahiriya, vaccine public policy health systems expert. Joining us this evening, Dr. Rajiv Seth, senior pediatrician and medical director of Child Health and Development Center in the National Capital. Thank you so much to both of you. Dr. Lahiriya, let's start with you. And I think one of the most interesting things that is about this vaccine is that it's needle-free. What are the possible ways then that it might be administered? The use of word jet spray is a little difficult to imagine when we talk about a vaccine.
Vaccines are intramuscular, which essentially means they need to be reached muscles in the arm of the person. However, this Zycov-D is an intradermal vaccine, which means it need not to go that deep into the skin of the person. So a special technology, which is called jet injector, through which a particular speed of vaccine will be injected in the skin, and it will penetrate just enough to reach the area of skin, which is dermis. And that's what the vaccine will be administered. So it does not require a needle, which essentially means there is a less likelihood of the side effects or induration or pain, which usually happens or associated with the needle. So that's the approach. It's a different mode or route through which it is administered, and that's how it will work. And this jet injectors are proven technology. They have been used in the past for various other approaches. So this will work well.
It's also the first DNA-based vaccine. Is that the reason why it's the way it needs to be administered is also different? What does it mean when we say first DNA-based vaccine, Dr. Lahiriya?
Yes, exactly. So we know that this is going to be the world's first DNA-based vaccine, though this also falls into a broader category of genetic vaccines, in which RNA-based vaccine or DNA-based vaccine both comes into same category. However, we know that vaccine manufacturing and administration is dependent upon the final formula. And by that formula,
we seem to have a technical glitch there. We've lost the feed with Dr. Lahiriya. Dr. Lahiriya, we're not able to hear you. Okay, we're going to try and reconnect with him. And get that audio line also back with him. But let me also say good evening to our other guests joining us on this conversation. Thank you so much, Dr. Rajiv Seth, for being with us. Vaccines for children, essentially, actually, outside of COVID vaccine, most vaccines are for children. That's when we get immunized. But of course, since in this round, it's the adults first who got a vaccine and then the children, there is much curiosity, much apprehension as well. What can you tell us about Zycov-D and information available about this vaccine?
See, one should be very confident that this vaccine has passed through rigorous trials. Phase 1, Phase 2, Phase 3 has been approved and emergency use after trials on more than 20,000 volunteers. The good part as a pediatrician for me is that can be used for children after 12 years, 12 to 18. Up till now, we didn't have any vaccine for children in our country. Children comprise about 440 million of our population. In the first wave, we have evidence that they were like super spreaders. Maybe 60 to 70% of the children were possibly infected, but we never tested them. In the Phase 2, we had more severe involvements in larger populations, and children also suffered from severe COVID, which is a multisystemic inflammatory disease. So children have not been going to school for last almost 2 years. They are not actually socializing. They've been away. There are behavioral challenges, emotional, other needs that have to be met, their development, and also exams. The class 12 exams could not be held for that reason, and, difficulties of moving forward in life. So I think this is a great vaccine. It's been licensed to be used for 12 to 18. Now, amongst the children also, there are special groups, and especially children with disabilities and, which are special with special needs, children with comorbidities, who should be prioritized. And I think over a period of time, we'll come to know how the government policy opens up when this vaccine is being rolled out. But certainly at this point of time, all the adults who have children must get their vaccines, because what I'm seeing in my practice is lots of children are still lots of adults are still under vaccine hesitancy. They're not taking the vaccine themselves, and they're thinking which vaccine and why this and why not. That's one part. The other is that one should realize that India is not just located into mega cities. The infection reached our tier 2 and tier 3, but also reached out to the most vulnerable, marginalized districts, aspirational districts in remotest area. And children are present everywhere. And so this vaccine is good. It will be good for adults. It will be good for children. With additional needs of more vaccines will be met by this Zydus Cadila. So we are very excited about this.
Dr. Seth, we were having a conversation earlier in the evening on social media where we were taking questions from people, and two questions that came up largely, with similar concern was what about children with certain health conditions? If there is a skin condition especially or a heart condition, then what should the parents do?
See, right now, whatever the research and data is available, that the COVID in particularly children who are immunocompromised, or children who have congenital heart disease, like you mentioned, children who have disabilities and children with special needs, they are more on the higher risk. But that kind of strategization has not taken. There are 1 or 2 studies that I can quote now for you. Children with skin disease certainly can be given this vaccine, but it would depend what kind of a skin disease are we talking of here. It's only a small portion of the skin that is needed to administer the vaccine. So I don't think that should be a problem. But certainly children who have immunocompromised, HIV/AIDS, and children who have disabilities or severe heart disease or failure conditions, multi-system organ failure, whatever, they will be needed more precautions, and it should be prioritized. But essentially, one thing is that the children have remained relatively healthier. The kind of COVID that they have had even in the first wave, even the second wave, has not been remarkably that severe. The deaths and mortality have occurred in senior citizens and people with comorbidities. And therefore, one can argue whether, they really need to be prioritized. But I, as a pediatrician, would say surely they should be, because they themselves are vulnerable many times, and also they are super spreaders of the disease. Plus, they have to go to school, and their education and their development and even their mental health is suffering.
Yes, which is why, it's such a big talking point today, because the mental health, the education, everything hangs in the balance for the children of our country. And I think largely everybody agrees that apart from maintaining distance and wearing masks, the only other tool we have available is the vaccine. Dr. Laharia is back with us. Dr. Laharia, you were explaining to us the DNA-based vaccines, how are they different, and if they have any specific advantages.
So some of the DNA-based vaccine, or this DNA-based vaccine, has advantage that it can be easily administered. That's one. Second advantage is that something called plug and play technology, which essentially means that since these vaccines are based upon the antigenic portion of virus, which produce antibody, and if there are some changes in the virus due to emergence of new variants, then the vaccine can quickly be modified or changed. So that's another advantage of this vaccine. Third advantage of DNA-based vaccine is that the DNA-based vaccine can be stored at the room temperature for up to 3 months. So it can be taken to the difficult terrains and areas where cold chain capacity is not available. So what we are hearing, lot many operational advantage of DNA-based vaccine. And I think that's a good news for all of us.
Okay. The other interesting part, of course, about this vaccine, and I'll come back to the aspect about children in just a bit, is that it's 3 doses. Now, that may also lead to apprehensions to say, well, when I have the option of getting a single shot vaccine, why should I go in for something that will require 3 shots? What would you say to that, Dr. Laharia?
Well, what we need to remember that all of the vaccines which are available are equally efficacious. So people should be concerned about safety and efficacy. Of course, the number of doses will be a challenge, but we also need to remember that other vaccines are given through needle and injection, while this will be administered in a different mode. So it's a slightly different and far easier. But if we compare another aspect, for example, a currently available Covishield is given at the gap of 12 weeks, while this vaccine, if somebody starts at the 0, 28, and 56 days, essentially in the 8 weeks, all 3 shots can be given. So each of the vaccine carry its own advantage and some of the limitations, but that should not be the consideration in my opinion.
Yes, and additionally, we don't know how many of these vaccines would actually also require a booster shot. That's also a big debate going on right now, whether those who've taken especially Covishield will end up getting a booster shot, Dr. Laharia, or needing one.
Well, so what we know currently that the current primary schedule is fairly effective and it can last for at least a year or probably longer. And the current priority to administer the primary schedule to as many people as possible. However, we also know that the immunity wanes off with the time, and most likely the single shot vaccine would definitely need a booster shot. We don't know the gap. The 2-shot vaccines and 3 shots vaccine are maybe more likely to provide longer protection, but this is an area which we will develop understanding over a period of time.
Okay, so let's talk a little bit more about vaccines for children. Dr. Seth, are there others? There was recently reports also about the NIV Pune Bharat Biotech product as well, which is under the scanner. Internationally, there are so many available. Help us put that in perspective, because parents will be keenly watching out for whether they should wait and put all their energies behind getting a Zydus Cadila, or will there be more in the market soon?
So I know that Covaxin, the trials are ongoing for ages 2 years to 18. So whenever the data comes out, and I believe it's going to happen soon, we will probably even be safer to administer COVID vaccines to children below 12 years. Remember, Zydus Cadila, the trials are from 12 to 18. So you will have this thing. Covishield is also conducting trials in children. There are evidences with Moderna as well as the Pfizer vaccines. Certainly, they have not tried so much in Indian population. The advantage of both Covishield, Covaxin, and the Zydus is that they are indigenously manufactured, and also availability. You see, right now with a 1.3 billion population and the immunizations have to reach out. I mean, this is a massive operation that's going on. See, as pediatricians, we always work on vaccinations, and and promote vaccinations. Many times, even in the very high income families, we see parents have vaccine hesitancy and they do not come and take all the vaccines. In remote areas, in slum situations, in villages, and the people living in the margins and their children, they also are equally important. And in fact, what I would go a step forward is the right to health and right to vaccinations should be a mandatory right for a child today. You know, these are COVID and other diseases are life-threatening diseases. And our universal immunization program for children has struggled for over several number of years. There are these aspirational districts which continue to suffer even today. So the thing is that here we are promoting COVID vaccines for children. This is also an opportunity to promote routine immunizations for children. I would send this very strong message to parents on your show who are listening that please do not forget that other diseases are all gone and there's only COVID. Your children need routine immunizations. In the aspirational districts of Mewat, where I work, in the Seda and other villages, the immunization coverage during the second wave was just 13% of routine immunization coverage, which is pathetic. So what we really need to ensure is the parents get COVID vaccines for children when they are released and they're available, but they also get the routine universal immunizations that are needed. Because the indirect effects of COVID on children are just too much. We know that we need vaccine for COVID in order to eliminate this disease, because we can't continue to remain in mask or sanitization and social distancing, hand washing, etc. for years and years to come. We have to win this battle. So COVID vaccine is important, but so are the other vaccines which are already available. Why not take them? What has happened is there are studies now that have come out. There's a study from Rajasthan, from Delhi and other places, which are said that due to the COVID, parents are not taking routine vaccinations. So childhood vaccination should be a basic right. Government is providing this free of cost elsewhere. But in the villages, I have seen that people, because of the risk of COVID, they are not even coming for routine vaccinations, which is a very big hazard, health hazard for children. So this should be promoted in your show, and I thank you for this opportunity.
Oh yes, you've actually made a very, very important point, very valid point. I think a lot of parents have forgotten as a push from the other end, from the government's end as well. So much attention is right now on the COVID vaccination program that, but together we need to remember that there are other diseases, other equally, threatening diseases that have to be tackled as well. Now, if I can come back to the larger debate here that we touched upon initially, is Dr. Leheria, should there be a prioritization system? This is the only one vaccine we have right now, which is also for age group 12 to 18. There may be few more in the coming months, but since we have adult population plus now children to be vaccinated, should those which are eligible or meant for children also only be kept for them? Should Zydus Cadila only be for children for now?
I think this had to be really important discussion in coming weeks and months. And there is a lot of interest and misconception among us parents about vaccination of children. So I want to flag two. One, that in no part of the world COVID-19 vaccines are being administered to children younger than 12 years. So younger than 12 years are not receiving vaccine in any part of the world. That's one. Second thing is that there is no international body or no organization say that vaccination is a prerequisite to open schools. So schools can be open even without vaccination. That's the two things we need to remember. Now, coming to the vaccination of 12 to 17 years. Now, with the licensing of Zycov-D in India, we need to break this into two parts. One is that this is really good and important thing that now India has one vaccine which is licensed for 12 to 17 years. But that should stop there. It should not mean that we should quickly jump to the vaccination of children. That had to be a second and independent process. The experts need to examine that whether children need vaccination and what should be the strategy. What we need to remember that there are few countries across the world which are giving vaccines to 12 to 17 years. In fact, if we know that United Kingdom has both licensed vaccine for 12 to 17 years and sufficient supply. But even then, their scientific experts have decided not to vaccinate all children between 12 to 17 years. What they have decided that only children with higher severe disease or higher risk will be vaccinated. The reason is that we know that children have a very low rate of mild or low rate of moderate to severe illness and mortality. Now, these vaccines prevent from moderate to severe illness and mortality. So if children have very low rate of this moderate to severe illness and vaccine prevent that illness, so the benefit of vaccination in children is far low. And then benefit of vaccination is in the adult population, which has high rate of mortality. So that's why adult population should be prioritized. Now, that's why I would like to reiterate that licensing is good thing, that we have one vaccine, so now we can make a choice. There would be one or two more vaccines licensed for 12 to 17 years and possibly 2 to 17 years. But licensing should not mean we should go for vaccination immediately. I'm sure that Government of India COVID-19 vaccine expert group would deliberate and look at the scientific evidence that now we have some product, how we should optimally utilize. I have heard that there is some initial understanding that most likely the vaccine in the 12 to 17 years would be administered to those children who are at higher risk and some other risk of developing disease. I personally think that we know that even within 12 to 17 years, the number of children is approximately 15 crore. Essentially, that would mean if this vaccine is used, 45 crore shots of this vaccine would be required. And we know that this vaccine would be produced around 1 crore in the first month and then 4 to 5 crore in coming months. So that is clearly insufficient. So it should be optimally utilized.
Okay.
And then we children do not need vaccines. So we need to be really nuanced, and parents should not put a lot of hope on this thing. Children do not need vaccines except for some selected children.
Okay, but Dr. Rajiv said, I'm sure, since you interact with children and their parents so frequently, most parents are right now hesitant about sending their children to school. Maybe more than parents, the governments are about reopening schools and seeing a flurry of cases. So then, as a policy, what would you suggest?
See, like doctor has just said, it really, policy is not mine. It's a policy which is well informed and well thought about by the team of experts, the National Task Force. Certainly, this vaccine should be given to children. We should give it to high-risk children for sure, and children who have immediate needs for examinations and actually, there were crores of children going into CBSE exam who just could not do the exams, for example. So those are the priority groups that I can immediately think, besides children with special needs, disability, immunocompromise, and other comorbidities. But certainly, yes, the government is committed to immunize everybody. So children are not just mini adults. They are human beings. They have human rights, and access to vaccine to children is a must. It doesn't matter whether you have so many crores children and so many this thing. They need the vaccines as well, as important as adults. But certainly, at this point of time, we need to continue mass scale of production depending upon our needs, and the demand has to be met over a period of time. Certainly, I believe that all the adults will be immunized by the end of the year, probably. So we need to have a fast track model for immunizing children and all children as well. So, but yes, I agree, this needs patience, it needs understanding and discussion and brainstorming.
Absolutely. Proper planning, prioritization perhaps as well, the way we did for adults, until the supply is limited at least. This government had estimated Zydus Cadila will be able to give us 5 crore doses by end of the year. I think it's going to take them a couple of months longer than that. Their own production schedule was a little hit and got delayed. And of course, our overall vaccination program did slow down. It's now picking up pace. So let's see where we reach by the end of this year. Thank you so much to both of you experts for joining me on this conversation and sharing your insights. So the good news is that this is a needle-free, pain-free version that's coming also for children between the age of 12 and 17. They will be eligible too. How will it work out? What will be the prioritization plan, the pricing? All of those details will come in the coming weeks. In fact, right now, even the full-fledged phase 3 trial data for this vaccine hasn't been fully put out in public domain, but we've seen in the past, even with Covaxin, we did go ahead and start administering those vaccines, and the data came out later showing a good deal of efficacy and safety. The drug regulator, though, has given its nod. Completely out of time. Thank you so much for joining us on this edition of the Urban Debate.